Welcome to Evergreen Family Medicine. Today we are with Evergreen CEO Dr. Tim Powell because it is once again time for Medicare open enrollment. And I know Dr. Tim has a lot of information to share. Dr. Tim?
Well, it's the time to share it too, Brian. Medicare open enrollment is actually a very important time for seniors, and most of them aren't aware of that. It's a time when they can adjust the coverage they have under Medicare. Now, if you talk to most people, they will assume Medicare's Medicare. It covers what it does, doesn't cover what it doesn't cover, but Medicare is Medicare. That's so not true. It's absolutely not true. Folks on Medicare have a lot of options, but if they're not aware of them, they may as well not have.
Well, one of the questions I think that comes up quite a bit is why should somebody consider a Medicare Advantage plan?
Medicare is way more complex than it ought to be, I think. I'm 72, I'm on Medicare, and when I begin to look in it for myself, and I've been in this my whole life, it's complex. You have Medicare Part A, and that covers your hospital charges. You have Medicare Part B, and that covers your outpatient. You have Medicare Part D, and that covers your drug. All these are different companies. All of these are different premiums, a whole bunch of different premiums, and then you get into the Medicare supplements, and man, there's about 15 of those different supplement types you can purchase, and an unlimited number of companies you can purchase them through. And then you have the issue of cost would be another reason, although it's not absolutely true that everybody on standard Medicare will save money on Medicare Advantage. Most of them will. Most all of them will. And lastly, what will most certainly occur is you'll have enhanced services. You'll have services on Medicare Advantage that you simply don't. And I'll tell you about some of those as we go forward. So folks may say, you know, I know what I have, I'm happy with the payments and everything's working fine. Great, don't change. But I'd just like you to be aware.
Yeah, and we have some answers to some of those confusing points coming up in just a few minutes. Dr. Tim's going to make this all really, really easy for you if you're watching right now. So I keep hearing about a new partnership between Evergreen Family Medicine and P3. What is this about?
Well, this is going to be a hard one to explain for folks out there that aren't in the business, but I'm going to try to make it relevant to them. I need to start by saying all Medicare Advantage programs or insurances are not equal, not even close. And Evergreen very carefully considers and then contracts only with a few that we believe really provide the best services for our patients. P3 is an intermediary management group, and they are positioned in between us, the provider, between the patient, and between the insurance company, just to facilitate and make things work. I have come to respect what they do to the point where I hope to have P3 engagement in the future with every MA plan we accept. They bring a lot of added value. Let me give you some examples of how that can happen. Patient care now can be fragmented. Patients go to a specialist, may go to the emergency room, they've been in the hospital, and may not have been local. They may have gone to Willamette McKenzie or Sacred Heart or OHSU or out of state. They may have had diagnostic studies. P3 will gather all of this data wherever it was given, and they'll extract from that any important findings and diagnoses and bring these to the attention of our providers so that when we see the patient, we're aware of them. The P3 team and Evergreen also collaborate in our most vulnerable patient. I have started at Evergreen a service I call Intensive Medical Management Services. And these patients are identified either by maybe going to the emergency room a lot or recurrent admissions, or we just see them in the clinic and see, wow, this person is really on the edge and at great risk of going the wrong way. A lot of time, solving that problem is not great medical wisdom. There's a lot of social or economic factors that are actually impeding the care. And so we have a conference where I bring in their provider, our social workers, our licensed clinical community health workers, our chronic care nurses. P3 then brings in their social workers and even their medical director, and we sit down and we talk about the case and we say, what do we need to do to solve this for this patient? I recently saw a patient, a gentleman in his 80s who had had a stroke. He had had that 10, 15 years ago, but gradually that paralysis on one side had come to the point, and his immobility and weakness, where his 85-year-old wife just couldn't take care of him, and we needed to get him stronger before we put him into a more long-term care situation. But we wanted to go directly from outpatient to the rehab program without what Medicare requires is 3 days in the hospital first. But we also then wanted to get him coverage through the Oregon Health Plan and whatever other financial resources we could get so he could afford the assisted living circumstances that he was going to require. So we bring all that to the group and we work on that. We're able to accomplish that because we have there with P3, who has direct input into HealthNet and Atrial, to say, set aside this. I know this is what you require. We're not going to require this, and we're just going to get this done because at the end, it's going to save money, and everybody wins. And so that's what I'm speaking to. P3 will bring in their pharmacists to talk with our providers about ways that we can actually save on medication costs. Really expensive inhalers, by giving them through an updraft, we can get them at where they're billed through Part B instead of Part D, and the patient saves a lot of money, and they can afford what we need to do. Lastly, standard Medicare does not allow a regular physical. They'll allow an annual wellness visit, but not an actual physical. With P3, our contract not only allows a comprehensive annual exam, it requires one. It requires one, and that is the centerpiece of our care for that patient for the whole year. So that's what they bring to the table, and it helps us. And I would like to think if the patient was ever that patient in that vulnerable situation, they would appreciate how we could really get the problem solving and help them as well.
Well, our next question is, what is new in the Medicare Advantage market here in 2022?
The newest entry in Douglas County is Pacific Source, offering the Medicare Advantage plan. They have just an outstanding Medicare Advantage plan. Pacific Source is well known to a lot of our folks here in Douglas County, mainly for its commercial product. A lot of the local businesses have Pacific Source. Evergreen does, and we're very happy with it. They're a non-for-profit company, and they're run by people who live in the Northwest. Very personal. Matter of fact, although patients are going to find them very competitive with cost and benefits, they're most known and most proud of their human service. It's one of the things they, well, not brag about, but they claim that if you call their company, that within 30 seconds you'll be talking to a human voice, and in this day and age that's rare. But they have a product that, well, things that they include, for example, would be a 3 months medical supply for 2 months cost. They provide not just hearing evaluation coverage, but hearing aid coverage. They allow great dental coverage, vision coverage. Their dental coverage is actually $2,000 annually for both preventative as well as other dental care. That is huge for my elderly people, and that's going to be very attractive. They offer $150 per quarter for just over-the-counter medications cost and stuff, where people can be reimbursed. And I should pause just to say none of the things I just mentioned are covered by standard Medicare. That's why it's a Medicare Advantage. But with Pacific Source, there's unlimited out-of-network benefits. There's no referrals required to see the specialist, so it's very travel-friendly as well. So I'm excited to see them in the market, and we have really worked with them to help bring their product in, because that's going to serve my patients when that kind of availability and that kind of support is there. I can take better care of my folks because it improves access.
Well, we've talked about a lot of things. There's a lot of information. Where can somebody get unbiased and customized information about everything that you've just talked about and sort of just simplify this for them.
Yeah, and this is so important, Brian. We really encourage people to seek out an independent insurance agent to guide their choices. These people are informed way beyond what I am about the intricacies of insurance, but they'll continue to support them then through the years when they have questions. They don't want to sell an insurance that the patient is unhappy with. They represent all of the products, so they're not limited. They have no dog in the fight, so to speak. And critically important for the patients to understand is these people are available at no charge. They're available at no charge. They're paid by whether it's the Medicare supplement or the Medicare Advantage companies pays them. On our website, we have a list of agents that we especially recommend to people. And then beginning October the 11th and going through December 6th, every Tuesday from 8:30 till noon at our Harvard location, patients are invited just to come in, and one of these agents will be here to talk with them. No appointment, come in, we'll have some coffee and snacks for you. The bottom line, and the reason we're doing this, and thank you for taking the time to talk with me today, Brian, is we want the folks to make the best decision. Affordability is essential to access. It's really essential to care. And when we can make it not only more affordable, but actually enhance the benefits, and then with this P3 management service to actually offer a collaborative service to interface with the insurance company, everybody wins.
Terrific. All right, Dr. Tim Powell talking Medicare open enrollment. The time is upon us. You can get more information at evergreenfamilymedicine.com. Thanks for watching.